This is a follow-up meeting for a continuation of the meeting where the Minister of Health had made some introductory remarks. And now we will receive the input and the response of the National Department of Health. Ms. Machalamba, can we just have attendance and apologies, please?
Good morning and thank you, Chair. Present is Dr. Jacobs, Mr. Munyai, Ms. Kela, Dr. Harvard, Mr. Kaba, Ms. Wilson, Ms. Ishmael, Dr. Tembekwayu, Mamuhlengwa, Mr. Van Staden, and Mr. Imam Sheikh. I've received an apology from Ms. Super. Thank you, Chair.
Thank you very much. We also, of course, have the officials from the National Department of Health. I'm certain whether we have the Minister and Deputy Minister, Mr. Joe Cutler. Can you give us an indication as the PLO?
Thank you very much, Comrade. Honorable Chairperson, honorable members, and good morning to everyone. Honorable Chair, the Deputy Minister and the DG are on the platform. I'm sure the Deputy Minister would take over. There's just an apology from the Minister. The Minister is attending Cabinet this morning. Thank you very much, Honorable Chair.
Thank you very much. So welcome to the Deputy Minister, and the DG is present, and I think I see some DDGs, etc. And they will indicate who will be doing the presentation to us a little bit later on. From the legal services teams, the state law advisors.
Good morning, Chairperson. Theo Achilles here, and honourable members. I'm here with my colleague Aisha Johar, attending today's meeting. Thank you, Chair.
Thank you. And from the legal services of Parliament. Is Ms. Isaac here? Not here. Thank you. Honourable members, before we continue, I must remind you that this virtual meeting is deemed to be in the precinct of Parliament and therefore constitutes a meeting of a committee of the National Assembly for official purposes only. In addition to the rules of virtual sittings, the rules of the National Assembly apply, including the rules of debate. Members enjoy the same powers and privileges that apply in the sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows the member to put up his or her hand to raise points of order. The Secretariat will alert the chairperson to members requesting to speak. And using the virtual system, members are urged to refrain or desist from unnecessary points of order or interjections. So, honourable members, we will proceed with this meeting. I will hand over to the department. I'm not certain whether the Deputy Minister will be making any short remark and introduce the team.
Yes, thank you very much, Chairperson, and good morning to all the honourable members and the team from the Department of Health. Just to echo what Mr. Khatla said, we would like to apologize for the Minister who's attending Cabinet this morning and may not be able to join us. I just want to, as you are correctly putting it, is a continuation of the meeting we've had, but we discussed the Minister just to highlight these important points that we have tried as a department to be in all the portfolio committee meetings, public hearings and hearings that were taking place in Parliament, focusing on this bill. We can safely say that we do have reasonably taken all the comments that have been raised in those meetings. We have responded to some, and today we hope to respond to others, including those that came in the matrix that was presented just a week ago. We cannot, however, make a statement that we have responded to all the comments. In the presentation that we will be making today as a department, we will show that we have considered some of the issues that have been raised by the portfolio committee members and also by the public. For instance, where there was an issue of why a minister alone to take this task or responsibility, the presentation will show that we have actually considered that comment and those comments that have been coming quite often. We also are aware that we might get some health facilities delayed in being accredited if we keep to a particular focus on NHI, probably because of infrastructure, and disadvantage a community that would have been served by that facility. So there are certain things that the department will say in that regard. We just hope that Honorable Chair and the portfolio committee members, especially those honorable members who have had some expressions of reservations on the NHI, might reflect on these considerations that we have made and go beyond what some of the members have been saying, that we support universal health coverage, but also may be able to say we do support universal health coverage model that has been brought to us by the department called the NHI. After all, Honorable Chairperson, all countries that have gone the universal health coverage route have actually reconfigured the universal health coverage to go with the conditions of their countries. I will therefore now hand over to the Director General, who will indicate who from us will then be making the presentation. Thank you very much, Honorable Chair.
Thank you very much. Thank you very much. And thanks to the Honorable Deputy Minister. I would like to invite our Deputy Director General responsible for NHI, Dr. Nicholas Crisp, to lead with the presentation. Thank you very much. Over to you, Dr. Crisp.
Thank you very much, DG. Good morning, Honorable Chair and Honorable Members. Good morning to Honorable Deputy Minister, my colleagues in the department, and everybody else present on the platform. Thank you very much. If with your permission, I'm going to put the video off while I put the screen up and share my screen for the presentation. Okay, thanks very much. I'll try and make it as big as possible so that it's easy to follow. Thank you very much for the opportunity to respond. As the Honorable Deputy Minister has given introduction and the Honorable Minister last week, there are a number of high-level comments that have been made, and what we are intending to do today is to go into a little bit more detail and respond pretty much clause by clause. So the layout of the document that has been presented and that we are going to go through today has in the left-hand column just a note on the section number and the bill. Then the second one is the actual clause in the bill as it stands now. Then we have comments on the National Department of Health's position and the recommendations that we are making to the Portfolio Committee for changes to be made to the contents of the bill as it stands now. So with your indulgence, I'll go through, and Honorable Chair, you will stop me if you need to stop me. Otherwise, I will just keep reporting. So on the preamble, we have made comments. I won't go into them. I'm not going to read them verbatim because, as you will see, there are 80 pages in the document. But essentially, we are obviously still convinced that what we need to do is to create a new framework. And we recognize that there are social and economic determinants of health. And this is not the entire intention of this bill. There are other pieces of legislation. This bill is intended to deal with the way to pay for quality personal healthcare services. And we are happy for the way in which that the preamble is stated. So we are not recommending any changes. When we get to the definitions, we did look at the definitions very carefully, and we've been through the content of the bill with the comments that were made. There were many comments made about definitions in various fora, and some of them are really wording changes, which I think are more of a legal nature, and others will consider. So we have two specific issues that we would like to raise in the definitions. The one is that we talk about suppliers quite frequently in the bill, and there's not a definition of supplier. So what we would like to recommend is that this supplier be defined, and on the right-hand column, the department proposes that a supplier means a natural or juristic person in the public or the private sector providing goods and services other than personal health services. And that's intended to avoid any potential misinterpretation of providers and others who are providing services as opposed to the goods that are required for delivering those healthcare services. The second one is that there is an interchangeable use of the term around health product, and we would like the health product definition to be the exact same product, the same definition as in the Medicines and Related Substances Act, so that we avoid any confusion in the interpretation of what might be required in terms of that act when this bill becomes law. Other than that, the definitions we think do reflect what the intentions are of the bill and define adequately what we are trying to achieve. There were other comments about uniformity and so forth, but we think that the way in which the bill is written at the moment and the definitions are recorded are fine. We don't want to make changes to them. Clause 2 deals with the purpose of the Act, and we think it is, as it is stated at the moment, it does reflect how we understand what we are trying to achieve, so we are not making any proposed recommended amendments to that. Regarding the application of the Act, there were a lot of comments about the desirability or otherwise of the comment of excluding the competition, the NHI fund from the Competition Act, and in the clause that's in the bill, it says in subsection 5, the Competition Act is not applicable to any transactions concluded in terms of this act. We read through the very many comments that were made about this, and we see where the possibility of misinterpretation can come in. So we are proposing an amendment to clause 3.5, where our intention is to exclude the fund itself from the Competition Act, but not to exclude everybody else from the Act. So our proposal is that we delete the latter part of clause 3.5, so that that clause reads only, the fund must be exempted from the provision of the Competition Act of 1998, and delete the remaining portions of that clause. The effect of that, would be that everybody else continues to be, in other words, providers and suppliers who are referred to in the bill will be still subject to the provisions of the Competition Act. Under Chapter 2, it starts off with population coverage in Clause 4. There were a lot of comments that were made both in the public hearings and in the oral presentations, as well as discussion in the Portfolio Committee, around the intentions of the fund and its coverage in section 4.1 of who are the parties to be covered. And there was a lot of input to be considered about dealing with tourists, immigrants, refugees, and asylum seekers in particular, as opposed to citizens. So we have looked through all of those, and we've also considered what is in our international agreements and what is in the international domain and the practice in other countries. So what we would like to recommend, first of all, that there is a use of both the words illegal migrant and illegal foreigner in the text as it stands at the moment, and that may create ambiguity. And the correct term is illegal foreigner, and that's the word that is used in the in the Refugees Act. So we would like to see in subsection 3 that the word migrants be deleted and replaced with foreigners for consistency. For the rest of this, we consider the section 2 at the moment. The services to persons illegally in the country are limited to emergency medical services and notifiable conditions of public health concern. And after very much discussion, debate, and as I said, looking into our international agreements and other documents, we feel we should not change that and we should leave that. Otherwise, we could have negative consequences on our ability to deliver services in the country. Clause 5 deals with the registration of users. And so there was a lot of discussion on this and perhaps some misinterpretation about what is intended with the registration of users. So the way in which we anticipate this to be applied is not dissimilar to what we saw during COVID with the EVDS, and that is that a person gets registered on the system once only. And once that person is registered, from then on, they do not have to register ever again because their record is in the system, and the processes that are being developed at the moment are that we are having a portable health record so that you are able to pick that record up at any time, anywhere in the system. So what is more important is that a person proves their identity so that when their record is opened, we are able to confirm that that is indeed the person that is being treated, and there's no chance of duplicating their care or giving their care to somebody else and creating potential harm. There are some particular words in subsection, in clause 5, subsection 7, the word, to find it, it starts off the clause with unaccredited health establishments, and we think that it more accurately should be accredited health establishments that's reflected in this clause. And then in clause 5, subsection 8, this is the last clause in, or subsection in this clause. This is where it deals with currently proof of registration, and we would like to see that change to proof of identity. So we would see this clause reading now: a user seeking healthcare services purchased for his or her benefit by the fund from an accredited healthcare service provider or health establishment must register, whereafter the user must present proof of identity to the healthcare service provider or health establishment when seeking those services. And that will make it easier that we just have to make sure that everybody has some form of identity. In clause 6, which deals with the rights of users, there were many comments that were made about the rights of users. There are, we have made some comments here in the text. Our comments go on quite a bit about the reasonableness of the grounds of the functions of the Benefits Advisory Committee and who benefits what and how, and the linkages to other clauses in the bill, which we will get to just now. So you can see we've made a lot of comments here. Chair, I wouldn't like to read it all because it's quite extensive. But what we did is we went through the comments that we had seen, and we felt that the one that is of particular concern that should be amended is in subsection 6(o), and I'll go to the clause first. It says at the moment, the rights of a user is to purchase healthcare services that are not covered by the fund through a complementary voluntary medical insurance scheme registered in terms of the Medical Schemes Act, any other private health insurance, or out of pocket, as the case may be. Now, we have a concern that other private insurance schemes are duplicating what is going on even in the current environment, and it's very difficult to regulate the healthcare environment if you have so many different and diverse ways of insuring. We would like to see all healthcare that is outside of the scope of the NHI fund, in other words, not covered by the benefits that are determined to be part of the fund's reimbursable benefits, to be all of them to be under voluntary medical insurance that is registered by Medical Schemes Act. And then, of course, out-of-pocket payments. We do recognize that there are international travelers who come to South Africa with different forms of insurance, and that will be dealt with in the regulations. It is the South African environment that we are concerned should not be duplicated with private health insurance schemes. So we can move on to healthcare service coverage, which is in clause 7 of the bill. There were some concerns that were raised, and especially around the Benefits Advisory Committee having unfettered powers. It's dealt with in other clauses as well, but we'll get to that in a moment when we talk about the Benefits Advisory Committee, because we think that by amendments in that environment, we will not need to amend anything that's in clause 7. It does outline the skills in clause 25.2, which we'll come to in a moment. It outlines the skills that the Benefits Advisory Committee must have, and is very clear on the diversity of the inputs that are required, including the considerations of technology assessment, which is covered here, and the health products procurement, so that we get the appropriate formulary, we get the appropriate benefits that are affordable, and that the way in which those benefits are delivered are coordinated across the referral pathways and so forth. So we think that this clause, as it is written at the moment, including the proposed management of central hospitals as national assets, are exactly as they should be. There's been a lot of debate around central hospitals since the dawn of democracy in 1994. And in fact, the way they're funded at the moment is still primarily through a national conditional grant. And the current National Health Act already makes it the responsibility of the national minister to appoint the boards and to determine what happens in central hospitals. So what is stated in this clause is building on existing policies and existing legislation, and we would like to leave it as it is and not amend this clause that is dealing with health service care health coverage. We think that it does adequately explain how we see things happening under the National Health Insurance. We'll come back to the Benefits Advisory Committee when we get to clause 25. Clause 8 deals with the rights of users. And there were a lot of comments about the rights of users. They interact with other clauses as well. But the intention of this clause is to ensure that, in line with the principles of the single purchaser NHI, and of course we all understand that that is a model we're talking about, not an absolute. All countries that we've looked at who have single purchaser models do have other purchasers, but they're not the dominant purchaser. So in terms of this model, users are not required to pay at the point of care. That's the bedrock on which this is built, and users should have the right to access healthcare because they need healthcare, not because they've got money. And that the way in which we could accommodate this and anything that falls outside of the benefits fund is our proposal under 8.2, where we are trying to make sure that the voluntary medical insurance scheme is not duplicated. So here's the proposed amendment. 8.2, a person or user, as the case may be, must pay for healthcare services rendered directly or through a voluntary medical insurance scheme under the Medical Schemes Act, or through a private insurance covering an international traveler with short-term or work visas or out-of-pocket payments. We feel that that will cover the potential concern that I raised in the earlier clauses. Clause 282B was discussed in the community hearings, in the portfolio committee, as well as in some presentations. Our concern is that 82B, which allows a person who fails to comply with the referral pathways that are prescribed to bypass the system and to set up a parallel healthcare system. We are concerned that that is going to undermine the basic tenets of the NHI bill and will be in conflict with the provisions of Section 33, which we will come to in a moment. So we would like to propose that clause A2B be deleted in its entirety to avoid creating this loophole in bypassing the purposes of the fund. Clause A2C, if you read the preamble, it talks about if that person or user seeks services that are not deemed medically necessary by the Benefits Advisory Committee. So we have looked at this, and we've looked at the comments that were made, and we feel that we could enhance this to accommodate some of the concerns that were raised and extend it to read, if that person seeks services that are not deemed medically necessary by the Benefits Advisory Committee or are not covered by the fund as promulgated in the regulations approved by the minister. And then we remove any potential ambiguity that the Benefits Advisory Committee is not being transparent or not, or is duplicating something that's provided for elsewhere in the bill. The centrality of the Benefits Advisory Committee is dealt with in that clause, so I don't want to speak too much about it here. But one needs to be cautious of reading one clause on its own, and that's the point that we try to make in our comments. And also, building on what the Honourable Minister said in his introductory comments last time, we want to avoid creating a very detailed and explicit piece of law that doesn't have any flexibility. And that's why there are so many provisions for regulations, and for the regulations to be promulgated with due timeframes and lots of transparency. So we think that, and we explain here about which of those regulations relate to this clause 8, and particularly to the contents of the remaining clauses when we remove A2B. In terms of the establishment of the fund, the clause just reads that the fund is established as an autonomous public entity contained in Schedule 3A to the Public Finance Management Act. We heard many comments all over, from the community meetings and hearings through the oral presentations and in the portfolio committee, repeatedly talking about public enterprises and not making a distinction between public entities and other bodies. So we really do want to emphasize in our comments that the Public Finance Management Act has different kinds of bodies. And Schedule 3A entities are national public entities, and they are not entities that do business, that generate revenue. They are more regulators and bodies that manage business, manage activities of government. So we anticipate that the provisions that are in Chapter 6 of the Public Finance Management Act and everything that goes with it, because that will apply to this entity, we do not need to elaborate further. It will just create even more confusion if we try to elaborate beyond what is in this clause. So we do not recommend any changes in this clause. We will talk a little bit more about, in fact, quite a lot more about the role of the minister and the department and when we get to those clauses, because they are very relevant to the fact that this is a 3A public entity. So bearing in mind that it is a 3A public entity, we look at the functions of the fund, which are described in clause 10. And the department did see some comments that were made in the hearings and so forth, especially about the potential for a monopsony and the way in which the fund works to undermine the ability to deliver healthcare. Now, we have looked at, over the several years and in the build-up to both the Green Paper and the White Paper, the research that was done in drafting this act, the department has looked at many countries to see how others deal with the functions of the fund vis-a-vis the department and other parts of the health system. And we have found that countries do not support the fragmenting of the purchasing capacity in their reforms, and that the centralizing of purchasing in this monopsony arrangement is actually fundamental to getting equity within a system. We have the worst inequitable and most inequitable system in the world. So we definitely need to have a way of dealing with it that is does not create parallel structures and parallel funding. So the functions, the way they are laid out, with the fund being structured to administer the money, but not delivering the services, creating the purchaser-provider split, but acting as the single payer and single purchase of the health services, it gives us an opportunity to get economies of scale and to create the incentives that are necessary to integrate the two very different parts of our current health system to the benefits of all. So we have made quite a lot of comments here, and we recognize that some of the detail of these functions will need to be contained in the regulations and will be amended over time so that we are able to have that necessary flexibility. So it's quite a long clause, but we do not think that the functions are inappropriate, and we would not like to see any changes made to the functions in clause 10. Clause 11 deals with the powers of the fund. And it's, as you have read in the bill and as we've discussed, it's what the fund may do to make sure that it's able to operate, purchasing the necessary goods, leasing a space to be able to function, having contracts for photocopy machines and the other equipment that is needed, and so forth. These are pretty normal powers. They are the same powers that are given to all Schedule 3A public entities, and we don't see that there is any particular problem here. When we get to subsection I, this is, I think, 1I 4. There were some questions raised about the way the fund works for receiving and collating of the required data. And there's a slight ambiguity, potential misinterpretation of this clause. So we do propose some strengthening of the wording of this clause. And we propose that if it reads to very explicitly include healthcare service providers, healthcare establishment, and suppliers, bearing in mind what we've said about the introduction of a new definition of suppliers, then it removes any potential ambiguity of what the powers are that the fund should have. Otherwise, the rest of the powers are similar to what one would expect to have in any Schedule 3A public entity, and we don't see any other further changes required. Now, when we get to Chapter 4, which deals with the board is obviously going to be immensely influential and powerful, and a large number of inputs, some quite negative inputs, concentrated on the fact that this board would be appointed by the minister and accountable to the minister. And so the complaints or the concerns that were raised in this was that the minister should not have the responsibility for appointing the board, and that there should be a more diverse approach to this. We have looked at the way in which other entities work, both Schedule 3A entities and the other entities under other clauses of the Public Finance Management Act. And we have looked at the Chapter 9 institutions as well. And our conclusion is that we can't treat this fund like a Chapter 9 institution because it's not provided for in the Public Finance Management Act to treat it in that way. But there are things that can be done to make sure that this concentration of power is not absolute. And we have considered the comments, particularly those made in the Portfolio Committee, about the role of Parliament and some other body to, if you like, dilute or complement the minister's powers in this regard. So in clause 13, where it deals with the constitution and the composition of the board, although the minister must be, in terms of the constitution, finally held responsible and is accountable to cabinet and parliament in terms of the constitution, so must be the one who signs the letters of appointment. We would like to make a proposal under section 13(3) A and B, and this is where it says the minister must appoint an ad hoc panel, and then that panel must interview shortlisted candidates and forward those candidates the recommendations to the minister. we think that there is merit in, if you like, adding authority and diversifying the minister's powers by making the minister first submit the recommendations for approval of cabinet. This is not an uncommon practice. It's even done with senior public servant appointments where all appointments go for approval of cabinet. And it means that there's a broader responsibility and the powers not vested only in the minister. Now, we did consider the comments that were made about the role of Parliament and the Portfolio Committee. And the challenge one has there is that if you look in the Constitution what the powers and the roles of the members of Parliament are, they are responsible, and the roles of yourselves in this Portfolio Committee, for oversight. And if one makes Parliament responsible for appointing people and appointing boards, you lose the two-tier or the stepwise accountability oversight, which Parliament must execute. So having looked at this quite carefully, we think that making this addition does mean that the minister must first get the approval of cabinet, and it is the minister and cabinet that must account to Parliament where the oversight will come overall. We do think that section 13.5 can also be enhanced. There were comments that were made, particularly in the Portfolio Committee, about ensuring that the board reflects the diversity of the country. So we are proposing that section 13.5 has a subsection F to state it explicitly and not allow it to be implicit. And section 13.5 raised particularly in the Portfolio Committee was what happens when one of the posts of the board become vacant, and it's not explicit in the way in which it is currently stated. So we propose that that should be added, subsection 5A, here between 5 and 6, that says whenever a position on the board becomes vacant before the expiry of the term of office of the minister may appoint any other competent person who meets the criteria listed in section 13.5 of the Act to serve for an unexpired portion of term of the office of the previous member, irrespective of when the vacancy occurs. So that you've always got a full board available for the decision making, since it's such an important part of the NHI fund. Section 13.9 deals with the minister's power to dissolve the board. And we think that the same argument that was made about not having the minister the sole discretion to dissolve a board, it's quite a radical thing. We think that there's merit in the argument that there should be a further checks and balances to this, and that the cabinet should be involved in the dissolution of the board. This is a very important body. So we are proposing an amendment that says, subject to paragraph B, which is when the board fails to perform their functions in the interest of the public, the minister may dissolve the board only after inquiry and approval by cabinet. So that's an inquiry is a far more powerful thing than the minister just asking the board to give reasonable opportunity to be heard and to make representations. It would require far more drastic and in-depth examination and then approved by cabinet before that happens. In clause 14, which also deals with the composition of the board, this clause deals with the chairperson and the deputy chairperson. The way the bill is structured at the moment is that the minister appoints the chairperson, but the board appoints the deputy chairperson from amongst the members. Once again, the same argument to try and get a broader consensus and a more diverse responsibility in the appointment of the chairperson. We propose that clause 14.1 be amended to say that the minister must, after consultation with cabinet, appoint a chairperson from amongst the members of the board. So in practice, what would happen is that when the minister calls for nominations and the ad hoc committee makes recommendations, the minister would then select somebody, and when from that group to be the chairperson, and when the minister presents to cabinet, he would also indicate who he intends or would like to see as chairperson of the board. In terms of the function powers of the board, there were comments that were made, particularly in the submissions, oral submissions, but also in the portfolio committee, that were concerned that the board's functions and powers were confused with the role of the minister, and the role of the board was a little bit confused in the way in which it was stated. There is some merit in that argument, and we did look at what exactly the concerns are or have been. And there is, in subsection 3, in particularly A, it says at the moment that the board must advise the minister on any matter concerning, and then it goes on to talk about the management and administration of the fund, including operational, financial, and administrative policies and practices. And the point that was made in those submissions, and which we have agreed in our deliberations in the department, is that one doesn't want the minister involved in the operations and the practices of the fund, but one does want the minister to be responsible and ultimately accountable for the policies of the fund. So we are proposing an amendment to 15.3 that just removes the portion that deals with the operational matters and will now read, the board must advise the minister on any matter concerning financial and administrative policies of the fund. So there's also in subsection 5, if we go to it, trying to find subsection 5. Sorry, and I haven't included in here. Oh, there isn't a subsection 5, of course. So one of the challenges is in a clause that's coming up just now is, when does the board and the CEO meet with the minister and other bodies? And we'll get to that just now when it talks about the role of the CEO in relation to the ministry. And so we are proposing that we add a clause here that says the functions of the powers of the board must be extended, and the board and the CEO of the fund must meet with the minister and the Director General of Health at least twice a year in order to exchange information necessary for the board to carry out its responsibilities. Now, the reason for doing this is because the National Department of Health, of which the minister remains the head as well, and the Director General, who is the accounting officer of the department, are still responsible for the overall system, both the financing and funding management portion that will now become part of the functions of the fund, and the provision. And that refers to the arrangements for the provision both in the public sector as well as the private sector. So in order to make sure that these two are harmonized, there needs to be at least twice a year meetings between the minister and the DG together with the board and the CEO. In the early phases of the implementation, we suspect that this should happen far more frequently because there will be a lot of early changes. But this act is obviously to be promulgated for a much longer eternity than that. There's a clause 16 that deals with conduct and disclosure of interest amongst board members. This is a fairly standard clause. It appears in just about all the other public entities we see. We did see some concerns that were raised about but they were generic concerns about guarding against conflict and corruption and capture and so forth, and making sure there's no conflict of interest. We agree with all the comments that were made, but if you read this clause as it's stated at the moment, it is pretty much what is required in terms of any conduct and disclosure of interest for any board. So we do not recommend any changes. Likewise, with the procedures, it says the board must determine its own procedures in consultation with the minister. That is consistent with other boards that we have in other entities in health and elsewhere in government. And the minister does account to Parliament. Although all Schedule 3A entities also account directly to Parliament, the minister is still responsible for all the entities under his or her powers and jurisdiction. So we don't think that needs to be changed. The remuneration and reimbursement, there were some issues raised about political office bearers and the way in which commissions are set up to look at remuneration and reimbursement. Now, this is a different kind of entity. You need to have those kinds of commissions for public office bearers because they are the ones making the decisions in Parliament. But in terms of entities, particularly 3A entities, all of that is governed by the Public Finance Management Act and the Treasury regulations, and the reimbursement and remuneration of both board members and of employees is governed to a certain extent. In fact, for the board members, it's completely governed by the provisions of the Public Finance Management Act and Treasury regulations under the Minister of Finance. So we don't think it's necessary to make any changes in that section. Now we move to Chapter 5, which deals with the Chief Executive Officer and the appointment of the Chief Executive Officer. The department did receive some, or we noted the concerns. We did receive some inputs as well. And we do note that there are concerns that the board, some people were saying the board should be entirely responsible for the appointment of the CEO. Well, in fact, they will be, but it is the current practice that the appointment of CEOs of all public entities are still run by the minister who is accountable for that public entity. And it is after the minister has seen the process, the nominations, the recommendations, and agrees that the person who has been selected is appropriate for the job, that the appointment is confirmed. It's not advisable for us to change and do it differently from the way all other entities are done at the moment. So we feel that this is appropriate and should not be amended. The responsibilities of the Chief Executive Officer are clearly to run the operations of the fund, and that is what is stated in clause 20. So there were some issues that were raised about clarity of the role differentiation between the committees and the CEO. But the committees are all stated as advisory bodies. They don't make administrative decisions, and they don't actually physically implement anything within the fund. It's the CEO's responsibility to do that. So while there will be units that are the de facto powerhouse or the technical development and responsible entities within the fund, the advisory committees are there to ensure that advice is given and that no irresponsible decisions are made. It's a checks and balances issue once again. So we don't think there's conflict between the responsibilities of the CEO and the CEO's duty to establish the necessary entities and employ the necessary people to do this, and the board's responsibility through the statutorily mandated advisory committees to provide oversight. So we are not proposing any amendments to this clause either. There was also some debate about the prescriptiveness of subsection 3 of the entities that must be established, or the units that must be established by the CEO. These entities, these units are all described elsewhere in the bill and are absolutely essential to the establishment of the functionality of the fund. There may be others, and so this is not a limiting factor, and they do not necessarily have to be independent. They can be combined. There's nothing in the clause here that says how the CEO must go about establishing them. It just says he must establish them. So we were not too concerned about the comments that were made. We think this is appropriate in the way that it is stated. Under clause 21, this was the clause I referred to earlier when talking about the role of the board and the board's interaction with the minister. There's a clause at the moment that says the chief executive officer of the fund must meet with the minister, the director general of health, and the chief executive officer of the Office of Health Standards Compliance. And it's the same discussion that I referred to earlier, is do you really want a chief executive officer to meet with the minister and the DG without the board? And so that's a valid comment that was raised, and the department feels that these meetings must happen and should be statutory required meetings, but they must include the board. So if the CEO is meeting as the at the level with the Director General, and the Minister is matched by the board that he or she has been responsible for appointing. The reason for doing this is to make sure that the various components of the entire health system are moving forward together and not apart. So we are recommending that in clause 21.1, there's just an addition that the CEO of the fund and the board meet with the Minister and the Director General. There's no problems with having the 4 times a year, and this is together with the Office of Health Standards Compliance. Clause 22 provides for staff at an executive level, and it's pretty straightforward. It says the Chief Executive Officer may not appoint or dismiss members of staff at executive management level without the prior written approval of the board. That is good management practice, and the other entities that we have in health already do this, so we do not foresee the need for any changes here. Now, there are 2 kinds of committees provided for in Chapter 6. There are the committees of the board, and then there are technical committees. They are in Clause 23 and Clause 24 of the bill as it is stated at the moment. The committees of the board are those which are where you would get in a company or in any other public entity, such as are provided for in the King report or the various King Commission reports, which are responsible for the sound administration and governance of the fund itself. In other words, an audit and risk committee, a remuneration committee, finance. Some of these bodies have communication committees and so on. So a lot of the comment that came was, and particularly in the portfolio committee and in the public hearings, in the oral presentations, some concern that if you set up too many committees, they become expensive and they duplicate and they're not useful. But you do want enough committees to have governance. So all of our entities in health, such as SAPRA, the Council for Medical Schemes, and the SA Medical Research Council, all have these committees already. And we believe that committees of the board in other entities other than health also have these committees. They don't need to be big, and they do need to have both the senior executive managers on them and members of the board, but they also need to have external persons, independent external persons. So we noted there was a comment made specifically in the portfolio committee that there's no provision under section 23, as there is in 24, for members of the committee to have not expose themselves to conflicts and so forth. So we
Dr. Shisana, please hold on. Dr. Shisana.
Yes.
Okay. Is that your microphone that is unmuted?
No, it is not.
Oh, sounded like you. Can the person whose microphone is unmuted please mute? Sorry about that. It sounded like your voice. Dr. Chris, please continue.
Thank you, Chair. So the department is proposing that a new clause, subclause 23.5, be added to read: a member of such a committee must act in a way that is impartial and without fear, favor, or prejudice, must not expose himself or herself to any situation in which the risk of a conflict between his or her other official responsibilities and private interests may arise, or not use his or her position or any information entrusted to him or her for self-enrichment or to improperly benefit any other person. That clause already appears in subclause already appears in clause 24, and we think that adding it here is prudent. So we're recommending that addition. Under the technical committees, these are committees that may be needed from time to time, that the board might comprise to look at specific issues. In other words, they're not committees of governance, they are committees to investigate specific things, such as health technology assessment, one or two specific investigations into pricing that may not be the responsibility of the pricing committee, any other kind of performance monitoring or risk management, and so on. So from time to time, entities find it necessary to draft a terms of reference for a fixed period, 6 months, a year, or whatever, to investigate something and then hand over a report and disband. Occasionally, these are committees that remain technical in nature for a longer period of time, but their need comes and goes. So our feeling from the department is that this clause is very important. The way in which it's worded allows the board the flexibility to do this. And we do note the concerns of comments that were made about creating costs and having expensive administrative capabilities and so on. I think that doesn't change. We acknowledge that that is important, and we will make sure that, well, we hope that whoever's appointed to the board make sure that the conditions that are...
Dr. Chris, can you please hold on?
Yes, Chair.
I need to silence that discussion in the background, but I can't make out whose voice it is really. Can that person please mute his or microphone?
Indicate also the company that you're coming from.
Can we get an indication of who that is?
Hi, it's Adrian Barker of the SABC. I'm mostly covered by my colleagues. I just want to know the 6 days around the corner. Is there any indication of when we will have access to the outcome and whether it will be made public, I assume?
Is that parliamentary streaming?
We will issue some of the things are already there. And then it will be the last one.
Yokazi, anyone else who can assist me?
Thank you. I would excuse. Chief Justice, this is the first time Parliament is really testing these rules.
I think it's Parliament streaming, Chair. I'm not sure.
Are not as
Ms. Majalamba, anyone else who can assist us? The host? I'm not even certain if I'm being heard, because there's no response from anyone.
We can hear you, Chair.
Thank you very much. Who is our host, Ms. Majalamba, Ms. Ngumane?
Yes, Chair, I responded.
Anyway, we can mute that.
Okay. That was
It's not reflected on the participants. So I'm not sure what is happening. The person who's talking, I don't think he or she is part of this meeting. I'm not sure what is happening because it's only Dr. Crisp who is unmuted. And
all right, let us continue then.
Okay, thanks very much, Chair. It's certainly not in my background. It's very quiet where I am, so I don't know where it's picking up. Thank you. So I was just commenting that on the departments has heard the comments and concerns that were raised about clause 24, but there are also provisions in the regulations to regulate how a committee is established and the terms of reference and how it gets appointed and so on. So we think the provision that's in the bill is appropriate and does not need to be amended in any way. Now, Chapter 7 deals with the advisory committees that are established by the minister. These are different from the committees, the governance committees that we've dealt with, and the potential for technical committees that may be needed in terms of those clauses of Chapter 6. Chapter 7 is fundamental to the overall decision-making of exactly what is provided and paid for and how it is paid for in the fund. So they are cardinal to and central to the objectives of the NHI fund. And the intention of these advisory committees is to make sure that when officials within the fund's structure develop things, that there is a sounding board where they are interrogated and they are objectively assessed before they are forwarded to the minister for sign-off to be included in the essence of what the fund is going to pay for. So the first one is the Benefits Advisory Committee, and it is explained in this section. We've looked through comments. We note the comments about health technology assessment. It is provided for in the transitional provisions, and it is central to everything that happens in developing all benefits anyway. And so we are in agreement with those comments that were made, and we are comfortable that all the other comments are accommodated in the structure of the advisory committee. So there's only one clause where we have picked up an inconsistency rather than anything negative. At the moment, the legislation reads in section 25(3)(b), that's this clause here, that a member of the Benefits Advisory Committee ceases to be a member of the committee when he or she is no longer a member of the institution that nominated him or her, or when he or she resigns. But since there's no intention in the bill or elsewhere for members to be nominated by any particular constituency or institution, this is not appropriate in this clause, and we recommend that portion be deleted, and that the clause 25(3)(b) should read: member ceases to be a member of the committee when he or she resigns, and that we delete the portion about the nomination by an institution. Otherwise, no further amendments proposed by the department here. The Healthcare Benefits Pricing Committee, once benefits are determined and defined by the fund itself and then have been to the Benefits Advisory Committee, they need to be priced, and the economic impact of introducing those benefits needs to be done and again checked by an advisory committee. So this committee is another stage in the check, more the economic and financial check before a benefit is introduced. There were some stakeholders who noted, and made comments. And the fund agrees that this committee is critical and that it must be impartial and that the members must have the necessary skills as outlined in clause 26(2). We didn't see negative comments. We just saw quite a lot of reinforcement that this needs to be an impartial and highly competent committee for the purpose. So we do not recommend any changes. Now, the Stakeholder Advisory Committee, there were comments in the community meetings and elsewhere about the composition and the intention of the Stakeholder Advisory Committee. And in the Portfolio Committee, there were questions raised about being more specific about the role of the Stakeholder Advisory Committee. We took advice elsewhere, and we spoke to other government departments who have Stakeholder Advisory Committees in entities about how they function and how specific to be. And one of the things that we noted from the hearings was that a large number of stakeholders wanted to see more specificity and to see their own interest, if you like, represented in the substance of the bill. But when we looked at it, we saw that the committee comprised of representatives from, and then there's a list here, statutory health professions councils, health public entities, organized labor, civil society organizations, associations of health professionals and providers, as well as patient advocacy groups. And then when we looked at the comments of people who wanted to see more detail, they are all captured in one or other of those different groups. So the expansion of this is probably ill-advised, and we decided that we would not recommend any changes to this statement. We also looked at whether to specify the terms of reference and how specific to be about the terms of reference. And we've been cautioned that it's very difficult to do that. What you want for the Stakeholder Advisory Committee is to have very broad agenda, so that at least once or twice a year, a forum is available where we can, the minister, the portfolio committee, and others can all hear what the stakeholders, and they are listed in this group of stakeholders, have to say about anything. So rather than be very specific about terms of reference, we should leave it open and make sure it's very inclusive when it is called together for meetings. So we are not recommending any amendments to clause 27. On clause 28, it's a generic clause that covers all committees, especially these three statutory committees, and it deals with disclosure of interest. There were some questions raised about how specific to be about declarations of criminal and other potential misdemeanors and so forth. We looked at the wording in other pieces of legislation as well and spoke to our other entities, and we are advised that this is broad enough, so we are not recommending changes. Regarding the procedures and remuneration, it's similar comments to what I made earlier about the difference between a 3A entity and a Chapter 9 institution and other forms of committees and boards. These procedures and remunerations are actually well catered for in the Public Finance Management Act, so we are not recommending any changes. There's a section in clause 30, it deals with vacation of office. So that is a vacation of office from one of these committees. And there's also the clause that we spoke about earlier that were included in the committees of the board and the technical committees that is not explicit in this section. So we are recommending that that should be added as well to make sure that there is that these people who are appointed to these various committees also act in an impartial way, do not expose themselves to risks, and do not make use of any information which may come to their attention in an indiscriminate way. So it's a strengthening of what is already in clause 30. So as I've indicated already, there was a lot of comment about the role of the minister and the powers of the minister. We've dealt with some of that in the clauses above when I've explained what the department's view is regarding the board and the appointment of the board. So one needs to go back to the Constitution to understand the roles of ministers and where the minister fits into the accountability framework and accounting to Parliament. And it's not specific to this minister who will ever be the Minister of Health. It's all ministers in their positions in cabinet and their constitutional responsibility and accountability to Parliament and therefore to the people of the country. So one does want to hold the minister of this portfolio accountable for the fund and for the way in which the fund pays for healthcare for the people. And that's what the current wording of this clause does. So we have taken into consideration the many comments which were raised about the role of the minister, but we still feel that there's no need to change the way in which this is worded. We're not proposing any amendments to this clause. The role of the Department of Health, I've also touched on earlier. It's outlined in clause 32. Now, this is the National Department of Health. The National Department of Health's roles are outlined quite clearly in the National Health Act, but it's in relation to the funds that these roles are elaborated in clause 32. There were some issues around the National Department, but they were quite small, just making sure that there's nothing in the functions of the department in the National Health Act that are in conflict with the roles of the department in this piece of legislation. It's clause 32.2. There were a lot of discussions and concerns raised, and this is the clause that provides for the shifting of funds. So if one is to create a single purchaser and a purchaser provider split,